Back in 2006, before I even graduated medicine, I visited the National Epidemiology Center in the DOH compound in Manila. Back then, the whole lot of HIV/AIDS cases in the Philippines cannot even fill a vertical filing cabinet. Today, they have to redesign a whole room full of filing cabinets. Hello, my name is Dr. Zero Miller and welcome to my show. The disease called AIDS started way back in 1981. Before, it was called GRID or GRID or Gay-Related Immunodeficiency Disease. Doctors back then were stumped at an outbreak of immunodeficiency killing related populations. The populations first involved were called back then as the 4H. H standing for homosexuals, non-homosexual Haitians, hemophiliacs, and heroin addicts. The number of affected individuals increased, and it was the CDC or the Centers for Disease Control in the US that coined the term AIDS in 1982. You see, before AIDS was discovered, immunodeficiency syndromes in medical practice are a result of a genetic mishap. People affected are usually born with a genetic defect. What AIDS was defined at that time was an immunodeficiency syndrome acquired after being born without a genetic defect, and thus the name acquired immunodeficiency syndrome. Doctors learned that the disease AIDS can be transferred to another patient through sex, transfusion, and sharing of needles. Of course, today, we know that the AIDS can also be transmitted from mother to child. It was only in 1984 that they were able to isolate the infectious agent, and they called it the human immunodeficiency virus. And it was also in 1984 that the first Filipino was diagnosed to have AIDS. In 1985, the U.S. Naval Medical Research Unit 2, or the NAMRU, collaborated with the Research Institute of Tropical Medicine here in the Philippines to conduct the very first HIV screening in the country. Worldwide, the disease started to spread like wildfire. In 1991, it was declared that AIDS was the #1 killer disease in Africa. In 1992, the Philippine government placed an importance to this emerging disease that they established the Philippine National AIDS Council with the Department of Health as its chairman and the other department heads as its members. From 1984 to 1993, the number of HIV and AIDS cases in the Philippines was only 475. In 1998, the first ever law protecting the rights of HIV positive and AIDS patients was enacted in the Philippines, and it was called RA or Republic Act 8504 or the Philippines AIDS Prevention and Control Act of 1998. A year later, the implementing rules and regulations of RA 8504 was approved. In 2003, the number of HIV/AIDS cases tripled to 1,526 total cases, and it was mainly due to the increased awareness and voluntary testing that was brought about by passing the RA 8504. In 2010, the Philippines is among the 7 countries with a 25% increase in incidence of HIV. And this was repeated in 2012 when the Philippines was declared among the 9 countries with a 25% increase in incidence of HIV. And in 2013, the number of cases reported in the NEC ballooned to a total of 14,515 cases. The following are the new cases for 2014. This is for January, February, March, April, May, June, July, August, September, and new cases for October 2014. In the first 10 months of 2014, the total number was already 5,010 new cases of HIV positive in the Philippines. The figures are already alarming, and the increasing incidence hinges on one simple intervention. What can you, a simple, aware individual, do to stop the spread of HIV infection? You can write down whatever comes to mind on the comments section below. You can also join me here on YouTube as we discuss more about HIV/AIDS in the next few episodes by clicking on the subscribe button below. Also, if you have Twitter, you can find me there with my handler at 0MD. And if you have Facebook, you can like my page at facebook.com/0melia. Thank you very much for watching the 0MD show. Mabuhay! I would also like to credit Mr. Celestino Ramirez for providing me with all the information for this video.